You're listening to the Skin Spectrum Podcast, your source for conversations about ethnodermatology. This discussion is all about our skin, the doctors who treat it, and the diverse patients who live their lives under it. Today's episode of the Skin Spectrum Podcast focuses on the lack of skin of color images in dermatology education. Our guests are Dr. Erin Dahlke, Adjunct Assistant Professor at Queen's University and Director of Dermatology Education at the University of Toronto, and Gagandeep Singh, a University of Toronto medical student. Here's their discussion.
Okay, thanks. And thanks for having us. I guess we should start with introductions. My name is Erin Dahlke. I'm a dermatologist subspecializing in Mohs micrographic surgery. I work at St. Joe's in Toronto and Hotel Dieu Hospital in Kingston. And I'm an adjunct assistant professor at University of Toronto and Queen's University and director of dermatology education at University of Toronto Medical School.
And my name is Gagandeep Singh, and I'm a third year medical student at the University of Toronto.
Gagan and I have been working all summer on this project, and we're super excited to chat about it because we think it's really important. So I guess I'll start by just giving some background. So this sort of started after 3 or 4 years ago now. We had 3 fantastic medical students, Emily Bellicoso, Sophia Oki, and Kennedy Ayu, who recognized in their first year of medical school in their dermatology week curriculum that there was very little representation of Fitzpatrick 4, 5, 6 skin of color, black and brown skin within the dermatology week curriculum. So they brought that forward to the faculty, and we decided to look more closely at that. We started with a study where we looked at how bad is this, and the answer is it was pretty bad. It was less than 7% of the pictures in the curriculum were obviously pictures representing Fitzpatrick 4, 5, 6 skin. And so we decided to do a needs assessment study based on that. And we surveyed the class, 2 different cohorts of medical school class at that time. And we administered, it was a voluntary, anonymous survey where there was multiple choice questions looking at making diagnoses of skin conditions in both white skin and in skin of color. And we also asked students how confident they were in making that diagnosis. So what we found from that study in both cohorts, we actually had a pretty good response rate. And we found that while students were pretty good at making the diagnoses across all skin types, there was a statistically significant difference in demonstrating a lack of confidence in making diagnoses in skin of color. So that in itself is very significant. If clinicians are not confident in their diagnoses, it can lead to delays in diagnoses, delays in care, and also can foster mistrust in the healthcare system in patients who are already systematically marginalized and racialized. So that was sort of the start of this project, and it really was something that was brought to us by students, and it led to a whole bunch of changes in the curriculum, some of which have already been implemented already, and some which we're pushing forward still and making more changes this year.
Yeah, and I think it's really poignant too, because when we looked at the Statistics Canada census data for Toronto, like more than 50% of the Toronto residents identified as visible minorities. And by 2031, almost a third of Canadians will identify as visible minorities. And this is the class that will be practicing family physicians and dermatologists by the year 2031. And so performing the curricular audit and finding that there was an underrepresentation of racialized skin tones in the curriculum, it's important that we did something about it.
It's something that's been recognized across many medical schools, but especially important in Toronto. And so we're excited to really be at the cusp of hopefully getting it right and making these changes going forward.
For sure. And dermatology also has that unique positionality in that, as I'm sure you know, a lot of it studies the cutaneous pathology or like skin conditions. And sure, there is that biologic component of skin conditions with phenotypic variance in skin color based on the amount of a pigment called melanin in your skin. But there are also larger social concepts also intersecting and underpinning these adverse health outcomes experienced by racialized communities. And a lot of that has to do with racism. And as we know, there are several, like examples of how racism impacts the health of racialized communities. We know Black people in the US actually experience the shortest survival for most cancers of any racialized and ethnic kind of group in the US. Also, the link between residential segregation and pediatric atopic dermatitis for communities who are socioeconomically disadvantaged or have barriers accessing health services. And there are a bunch of institutionalized policies, procedures, and systems that all kind of work together to create and perpetuate these inequities. But we think that projects like these are probably one prong of many efforts that are required to address these health inequities. And so from the medical education standpoint, what can physicians do by applying anti-oppression and social justice principles in their daily practice, in their personal lives, in their interpersonal patient-physician relationships to reduce adverse health outcomes, improve the trust racialized communities feel they can put into the system when they're accessing health services. And all these things come together at the end of the day to hopefully create a picture where we're all able to work together towards something better.
Yes. It's been so great working together with you, Gagan, because you have such, a strong foundational knowledge in EDI and anti-oppression, and to be able to sort of marry that with the dermatology curriculum and making these changes, it's been a great collaboration. And I'm so thankful that we've been able to work together on this. So the dermatology curriculum, some of the things we were working on were quite simple, like improving visibility of skin of color within the curriculum, within our large group lectures and our PowerPoint slides. We spent some time this summer updating e-modules and making sure that there was more even representation across all skin tones, adding themes of EDI within our e-modules to speaking directly in acne management to health of patients who are trans and trans care as it relates to acne treatment was something we were working on as well. What we did last year too was we added some new learning objectives in the dermatology week, speaking about identifying skin disease presentations unique to Fitzpatrick 456 skin, and also, as you mentioned already, appreciating how socio-medical experiences can differ in racialized populations. We also made sure we had adequate resources for our curriculum. And then what Gagan's been working on too is interweaving these themes of equity and diversity into our small group teaching, which is really getting to be able to look at the dermatology curriculum with an anti-oppression lens.
And we thought that was very important for a couple of reasons. One, in that sometimes we feel that anti-oppression and social justice work is kind of done in silos. And so, as Dr. Dahlke was mentioning, we were working to incorporate improved cultural competencies relating to racialized dermatology care, but also trans and gender diverse patients accessing dermatology care. And this work is sometimes siloed and presented to students in individual modules. And in some ways that can be othering. So our approach for our project really was to integrate these anti-oppression principles throughout the dermatology curriculum so it doesn't feel secondary. So it feels like it is a core competency and core knowledge.
Exactly. It's not specific to Dermatology Week, but we're recognizing that it has a place within dermatology because of this not so great history that dermatology has of pretty much teaching just to white skin and having these classic morphological descriptions really be based in only white skin. So, there is this foundational problem and this piece for improvement. And then, so how can we take that further and incorporate other themes of anti-oppression within Derm Week? And it's just been a nice way to spiral the curriculum based on what the medical students are already learning. And also, we've had the opportunity to bring this to our dermatology tutors who don't maybe have that knowledge base that the medical students are getting right now in their first and second years, because people like myself and my cohorts and my colleagues, we were not lucky enough to have that training in our medical school. So, we're creating this one anti-oppression video that's for tutors as much as it is for our students.
Yeah, and that video is really important because it's one of many initiatives that are really intended to build that cultural competency amongst not only students, but faculty. So in advancing social justice and anti-oppression frameworks and integrating them into the medical education system, it's also really important that the way the content is being delivered in a way that's safe. And we don't ever want to have material delivered in an unsafe way so that students who may identify with these different communities that are being spoken about are feeling othered or are feeling disparaged. And so this video was also a great opportunity to provide cultural competency training and links to some of our other goals of this project, which is really to create opportunities for scholarly equity work to be distributed widely in medical education contexts so that individuals in disciplines other than dermatology can also apply anti-oppression and social justice themes to the way that they're teaching, to the content that they're teaching, and allow students to reflect more critically on maybe the social aspects of medicine that may be impacting patient experiences and care. And these scholarly outputs we think are really important because it also provides a framework for how to approach some of these sensitive issues. And a lot of work in anti-oppression and social justice is sometimes burdened by individuals from equity deserving groups or marginalized communities. And by providing a framework or at least a process for how we completed our project, we hope that it can be adapted for their contexts and their goals and motivations to improve medical education outside of just dermatology as well.
Yes, and within dermatology, we know across the country a number of medical schools are struggling with these same concepts. So, like, I feel like we've attacked this quite broadly. We've taken a multi-pronged approach to turning the curriculum around and getting this right. And that being said, it's something that is going to require constant evolution and reevaluation and reframing. And I'm excited about that. And I'm hopeful this is something we can share with all of the dermatology programs across the country and hopefully sort of lead the way in having a progressive and dermatology curriculum that is seen with an anti-oppression lens and that really puts equity and inclusiveness at the forefront.
Yeah, I think that's so important, really maintaining that lens of reflexivity and reflecting on the fact that while this is a good step forward, progress isn't the same as resolution. And I'm not sure there ever will be a resolution. In some ways, communities will always be experiencing some levels of oppression. So it is an opportunity to always push forwards and advance healthcare in a way that is benefiting everyone and not just groups with certain privileges as well.
For sure. And I think what you bring up about reflecting is so important too, because when you're making tough changes like this in a curriculum, it's often two steps forward and one step back. And I think to be setting the tone in a positive way, to letting our students know that these are the changes we're making and we're open to feedback and communication, and we want the students to tell us what they think and how we can further improve, and that's an ongoing process. That's not something that's done in a year. And recognizing too that we're still at the beginning of this journey, and this is something a lot of us are learning more about every day, and recognizing that there's always more work to be done.
For sure, yeah. And even the way this project was structured, it was really interesting as a medical student trying to create teaching materials that would be delivered to cohorts very near to my level of training. And at times I felt very out of the waters with more biomedical aspects just because I hadn't learned it yet. But it was really nice having mentorship and leadership from yourself and the MD program's Black Health lead as well to come together and create resources in a way that also captured maybe some of the issues that are more apparent or uses language that is more familiar to our level of training and individuals in our cohort, just from a generational point of view as well. And it really shifted the paradigm in terms of like students just sitting back and absorbing information in medical classrooms, but now also contributing to the medical curriculum. And I think that that's so powerful because as the diversity in across medical specialties increases and as more people are gaining access and entry into medical school, it's important that these environments are also safe for those individuals and it doesn't feel othering or it doesn't feel like you don't belong. And initiatives like the Black Student Application Portal or the Indigenous Student Application Portal here at U of T, it's comforting to know that issues are being flagged in some ways.
And it's so humbling for me, and it's such an honor to be working with you. Also, I should mention Dr. Noram, who has been working with us too on this video project. And when I'm surgically teaching, fellows and residents and medical students, there's a real hierarchy to knowledge. And this has been like the most amazing and humbling experience for me, with really trying my best to go in with a growth mindset, because there's so much to learn. And when we're looking at creating this video for tutors and students alike, like, don't get me wrong, I'm sure there's a lot of students who have a lot to learn, but like, it's the tutors who have a lot to learn. And like, really, it's important to get the faculty development piece right, to make sure that we're setting the tone in a positive way, and to recognize that in medicine, it's a commitment to lifelong learning. And we have so much to learn from our students. And it's been a really great team environment. And I've learned so much, and I'm so thankful to be involved in this project.
Yeah, and just like even in the video, being able to provide a positive outlook on the work that is being done here locally at U of T and across the world internationally as well, with publication of the book Mind the Gap, featuring various skin conditions across a range of skin tones as a resource for medical trainees to access to augment their learning. It can feel a little bit tough at times working through these issues, and it can feel like there's so much work to be done, but I think there was also an opportunity in our project to celebrate the work that has been done and realize there's so much going on and that we aren't alone doing this. And I think that ties back to why it's so important to tell people about the work that you're doing, either publishing it in academic spheres or sharing it at the community level.
Yeah, I couldn't agree with you more. And there's so much interest in this. And, the more we dive into it, the more we find too, we're trying to incorporate all these new great resources like the Mind the Gap book and Brown Skin Matters Instagram account, and lots of even, social media and other places you can find learning related to anti-oppression and EDI that directly relates to dermatology too. So, that's why we really feel it does have a place in Dermatology Week. And this curriculum revamp is something that will be helpful for U of T students, but even on a greater scale. Yeah, it's funny because we go through our training, and even when I was training, I remember, working with residents who could not recognize erythroderma in patients with Fitzpatrick 5-6 skin, just because they weren't taught it and it's not in textbooks. And I remember when I was a trainee and I was working in a pediatric dermatology clinic, and we kept seeing kids with pityriasis rosea, like young Black children, skin of color with pityriasis rosea. And I remember asking my staff, oh, how come is this more common in skin of color? We're not seeing any little white children with this condition. And my staff's answer was, oh, the family doctors are really good at recognizing and treating this in white skin, but not really in skin of color. So that's why they refer to dermatology, and that's why we're seeing it more in this population. And, it's so funny because that was so long ago when I was training, and then I inherited this curriculum and then perpetuated the problem, which was only teaching the Kodachrome morphological image of pityriasis rosea and white skin. So, I'm embarrassed with this story and thinking back of it, that how like I have this memory of this problem. And then I went on to become the precursor director and inadvertently perpetuated it. So I'm so thankful for the students who brought this forward. And it was a blind spot for me for sure. And I know it has been for others as well. And I'm just very excited that we're fixing it. And we're going to make sure that all doctors who are going through medical school at U of T are going to be able to treat common skin conditions and rare but serious skin conditions. I mean, you don't have to be a dermatologist, across all skin type. And that's so important.
And it speaks to the delay in care as well. In the way the Canadian healthcare system works, having to be referred to a specialist, a dermatologist, to be seen for a condition that could be managed at the primary care level, especially with the psychosocial implications some of these conditions can have on anyone, particularly children who may be also subject to bullying in school. And so all these different social factors converge and, result in adverse physical, but also mental health outcomes. And this blind spot, though, I think speaks to just a lack of resources also that existed. I know we had so much difficulty for some conditions, just even finding good teaching material of certain skin conditions on a backdrop of phototypes 4, 5, and 6, which are predominantly represented in racialized communities. And
Yes, and I mean, there's studies looking at textbooks that have shown that, our most common dermatology textbooks, really it's a small minority of images that represent Fitzpatrick 456 skin. And again, that's something that is being improved. And I feel 5, 10 years from now, like it's, even hopefully 2 to 3 years from now, that won't be the case, but it certainly was historically. And I'm excited that we're at the forefront of improving this and fixing this.
For sure. The goalposts are always moving, I find, which is great. Forces us to be reflexive.
Thank you to Dr. Dahlke and Gagandeep Singh for their informative insights and experiences. The Skin Spectrum podcast is produced from studios in Buffalo, New York and Toronto, Canada, by Chronicle Companies, publishers of the Chronicle of Skin and Allergy and organizers of the Skin Spectrum Summit. Visit us at www.skinspectrum.ca or www.derm.city, where dermatology lives. Subscribe to the Skin Spectrum podcast at Apple iTunes, Google Podcasts, Stitcher, Spotify, or wherever you get your podcasts. This episode was produced by Jeremy Visser. Research was done by Kylie Rabernick and Catherine Brenders. Until next time, thanks for listening.